HLTHPS007. This is administer and monitor medications. First of all, I'd like to do the acknowledgement of country. In the spirit of reconciliation, Meditech Training College acknowledges the traditional custodians of country throughout Australia and the connection to land, sea, and community. We pay our respect to the elders past, present, and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people today. The objectives for this presentation include identifying potential risky situations before giving medications. The performance criteria include access and read information to enable identification of substance incapabilities based on care plan and delegation, identify environmental and time management issues that may impact on or contraindicate medication administration, report potential risk related to medication administration to delegating health practitioners, confirm client's identity and if any allergies exist, identify drug and poison schedules and classifications as determined by law, and proactively identify any limitations in your own capabilities in relation to undertaking delegated medication administration function and report to the delegating health practitioner. Identifying substance incapability based on care plan delegation. So, substance incapabilities are physical and chemical reactions that occur when mixing a drug and other substances that may decrease the treatment effectiveness or toxicity, which can be harmful to the client. When you know about the substance incapabilities, you can withhold the medication and notify the delegating health practitioner immediately. Failure to identify substance incapabilities will negatively impact the client's health. There are different types of substance incapabilities, which include medicines and diet, medicines and alcohol, and other substance incapabilities. Down below, I've mentioned some examples of each of the substance incapabilities. So for medicine, we have warfarin and aspirin, which have the same effect of thinning the blood. Now, when these medications are given without the delegating officers or the delegating health practitioner's instructions, this can be very harmful to the client, as this might lead to excessive bleeding or internal bleeding, which can lead to death or very harmful situations. We have medicines and diet. Under medicines and diet, we have simvastatin, which is a cholesterol medication. When mixed with or when given with grapefruit, doesn't have the effect that it's meant to have. So the medication doesn't have the effect desired. We have medicine and alcohol. Now, alcohol is a depressant, and when given with an antidepressant, again, the medication does not give the desired effect. Um, and we can tell that antidepressant and depressants um, cancel each other out. Other substance capabilities can be specified in the care plan, the delegation by the delegation officer or the health practitioner, or you can also see it on the medicine label. Now, I've included delegation instructions through care plans and what must be included in them. We have the medication and its purpose, medication forms and instruction, dosage and related instructions, administration routes, contraindications, substance incapabilities, and other relevant information related to the client. Identify possible contraindications before administering medications. So I've mentioned two different types of issues on the possible contraindications before administering medication. We have the environmental issue, which are conditions related to the physical environment that contraindicates the administration of medication. Improper storage may lead to serious health issues or decrease the medication's effectiveness. Now, these environmental factors include humidity, sunlight, and temperature. We also have time management issues. These are conditions related to the frequency and timing of administering medication. The client should take their medication at the level of frequency and the time specified by the delegating health practitioners. Overdosing can be harmful to the client, and overdosing might not give the desirable effects. Reports potential risk related to medication administration. Risk are possibilities of harm or negative sort of impacts affecting someone or or a client. We have allergies, we have pregnancy, breastfeeding, or intention, sorry, to either to do both or to either to do to be pregnant or breastfeed. We have health history of illnesses, we have medication history, we have substance capabilities, and we have other illnesses and medication conditions the client is experiencing. I mentioned some reporting concepts in this video. We have delegation. Now, delegation is one that confers authority to a worker to perform specific medication administration activities. Supervision is instructing and advising or monitoring another person to ensure that they are safely and effectively performing the activities of their position. Responsibility is a set of duties or actions and actions that are part of one's job position or duty. And accountability is a concept that one takes ownership of work responsibility outcomes. Here are some general ways you can follow to report to delegating health practitioners appropriately. First of all, know the delegating health practitioner you must consult with. Put all observations into writing so that you can keep track of data. Make sure you clearly understand the care plan and written delegations. Follow instructions properly and do not make modifications. Update the delegating professional about the progress and outcomes of the medication. Always consult with them in any concerns if you have any concerns or questions. And finally, collaborate with your delegating health practitioners respectfully and politely. Confirm the client's identity and if any allergies exist. Principles are a set of values that form basis of something. There are five rights of delegation. We have the right person, we have right task, we have right circumstance, we have right directions and communication, and we have right supervision and evaluation. These are examples of medication that commonly cause allergic reactions. They include aspirin, insulin, antibiotics, anti-seizure medications, chemotherapy drugs, and anti-inflammatory but non-steroidal drugs like ibuprofen and naproxen. Identify drug and poison schedules and classification as determined by law. Administering medication involves knowing whether a medication needs a prescription. Knowing this will help you work within the Australian law. You can identify if someone needs a prescription requirement by knowing Australia's drug and poison schedules. Now, there are more than four schedules, but I've just mentioned the main four that you might see or medications you might see when working. Now, the first schedule is Schedule 2, which are pharmacy medicines. This is substances for therapeutic use that should be available to the public and should be sold without or could be sold without the professional supervision. We have Schedule 3. These are pharmacist only medications. These are substances that therapeutic use that should only be sold by a pharmacist or under a pharmacist's supervision. We have the Schedule 4, which is also known as the S4. These are prescription only medications. These are substances that should be available for use by appropriate practitioners or require the professional supervision because of potential for abuse and patient safety. We have Schedule 8, which are S8. These are controlled drugs. This is substance subject to restrictive regulations in order to reduce abuse, misuse, and physical or psychological dependence. Identify limitation to your capabilities when undertaking medication administration. It is vital to know your limitation when undertaking delegated medication administration. This is to ensure that no harm comes to the client. Limitations are the boundary between what you can do and what you can't do when administering medications. Safe practice is a set um, of actions and procedures that should be done regularly. This may include the following reporting lines, operating within one's limitation, communicating clearly, checking your organization's policy and procedure and protocols when reporting risk, and finally, recording and reporting progress and outcomes accurately. So what have we learned today? We've learned how to identify potential risk situations before giving medication. We also learned how to access and read information to enable identification of substance incompatibilities based on care plans and delegation. We identified environmental time management issues that may impact on or contraindicate medication administration. We've also learned how to report potential risks related to medication administration to delegating health practitioners. We've also learned how to confirm client identity and if there are any allergies, if they have any allergies. We've also identified drugs and poison schedules and classification as determined by law. And finally, we've also learned how to proactively identify any limitation in our capabilities in relation to undertaking delegated medication administration functions and reporting to delegating health practitioners. What to do next? So this is your call to action. So we need you to complete your e-learning modules for chapter 2. Also watch the knowledge question video tips and finally complete the knowledge question. I believe there are 10 questions there. All right. Thank you for watching.